Hopefully we've got some good anesthesia here. We're going to make a little incision. Are you ready? Good. There's our culture. Right, good. You ready? Oh, wow. Okay, that's pus coming out that you feel. Okay?
Okay.
This is a really nice abscess you've got here.
Thank you.
You're welcome. You're welcome. All right, let's put our knife down for a minute and don't go anywhere. Can you open this for me, please, ma'am? And if we don't do a culture, I'm going to get griped at. So these are always staff. I've not had one of these come back that wasn't staff. All right, so here's our culture from right in there. Is this the correct set way? You don't pull it out? Take that out for me. There we go.
Is that better?
This goes down in there.
You need more?
And you break this. Okay. You feeling all right?
Mm-hmm.
Okay, now we're going to do a little squeezing on this. We're going to get more out. If this squirts on me, I'm going to scream. You all right?
Mm-hmm.
Okay. Oh, wow. We're getting clumps out now.
Sorry.
Oh, Mom.
All right, I got some more gauze here. I'm going to get more out here. Good. You feeling some pressure, right?
Mm-hmm.
Okay, good. It looks like there is a little underlying sebaceous cyst. I'm seeing more than just pus here. I'm seeing some oil.
Mm-hmm.
And that's what a sebaceous cyst is. It's a collection of oil from the skin, or sebum. Okay, you okay?
Mm-hmm.
Is that Mom doing that to you?
Yes.
Mm-hmm.
Okay, Mom. You're missing the fun here.
No, I'm not. I'm saving you from me passing out.
Oh, you're not going to pass out, are you?
Yeah.
Ooh, this is pretty nasty. It really is. We've got Carla observing today. Say hi, Carla.
Hi.
Yeah.
I'm having fun back here.
Aren't you having fun?
Mom's looking at her weird.
Yeah, everybody in the video can't really see, but Mom's sitting on the floor holding our patient's hand because she's wonderful in supporting her daughter in all things, including pus-filled sebaceous cyst.
Hey, really? Are you squeezing it or something, Doc?
Yeah, we're squeezing.
Yeah.
She's not giving me any feedback, so I'm believing that she's not having much pain. Is it hurting a lot?
Yeah.
Whew. I can't tell you how bad this smells.
Oh, my gosh.
Did you smell it?
No.
Oh, you don't want to.
No.
We're going to press on it again, okay? We want to get as much out as we possibly can without making a big incision. I made a little incision, okay?
Okay.
And we could make a bigger incision. It'd probably be easier, but then you'd have a bigger scar, so we want to avoid that. And such a pretty young lady as you. Ooh, look at that. It looks like a toenail just came out of there. Did you see that? That looked like the part of the pudding that gets stuck to the side that gets real hard, you know? Well, that's
You
kind
have
of.
to be so graphic.
Well, I'm trying to describe to my patient who's hooded currently.
She will see soon enough.
She's going to see it online. You're going to go online and look, aren't you?
Yes.
No doubt. She
Okay,
won't
I'm
need
working a
her.
lot of this out. It is really bad. You probably would have thrown up.
No, she wouldn't.
No, you would have though.
Yes, I
Yeah.
would have passed out.
That's why you couldn't video this.
Ow, Jana.
Don't say her name.
Oh,
We're trying to protect her identity.
It's too late now.
I'm gonna have to bleep that out or something.
You sure?
You okay?
Mm-hmm.
Okay, you're doing a really good job.
ask me if I'm okay.
You're okay? Are you okay?
My hand's numb.
Well, you all right? Take some
Yeah.
deep breaths, okay? I still feel some more in here, so I'm gonna try to get it to come on out. Looks like we might be at the bottom here. Oh, there's a little piece that came out. Have you felt this kind of that area being kind of thick and full before this? I know you said like 10 years ago you had something, but
Yeah, it's been I thought it was like scar tissue. It was just a knot, and it didn't change in size, and it stayed the same for the past 10 years.
yeah, you got some more coming out right there. There's a hunk of it, looking kind of bloody though. I think we're almost to the stopping point here. Okay, one really good push. You ready? Breathe. Okay.
I'm not breathing.
Okay, so now we're going to put some packing in here. Carla, can you open that packing for me?
What packing?
You open that and then the forceps. Okay, we're going to put some packing in, okay?
Okay.
We want this to stay open. So we've got a fresh new bottle of packing strips. Okay, very good. Here, just sit it down right there for me. Freshly open, ready to go, and we are going to start packing this wound, okay? Hopefully,
is that painful for her?
it shouldn't be because we still have some local anesthesia, right? Does that hurt?
No.
You should be able to feel it like some pressure, but it shouldn't be sharp pain, okay? Here we go. We're putting more in now. So today is the 30th of December. The poor Texans did not make the playoffs.
What?
No, they didn't make the playoffs. How about that J.J. Watt, though, right? What a player. Little
That's
shout
who
out.
she's gonna marry. That's gonna be my son-in-law.
Have you seen those J.J. Watt t-shirts that girls are wearing?
Mm-mm.
They say, "Sack me, J.J." I think they're kind of cute. I think they're kind of cute, yeah.
Yeah, how would you feel if your daughter wore that?
If it was for J.J. Watt, I'd be okay with that. I mean, obviously she's a little young now, but if she was of the age where she was, thinking about those kinds of things. We're putting a lot of packing in here. Are you okay?
Mm-hmm.
Okay, good. Just want to make sure you're not hurting.
Nothing that a massive amount of alcohol can't help.
Well, that's what we had for anesthesia 100 years ago, or 150 years ago. All right. Okay, we're going to pull the packing out, okay? Let's take a deep breath. Blow it out. And again. All right. Very good.
You okay?
Mm-hmm.
You can punch him later.
Yes, that's always okay.
I give you permission to punch him.
Now I have a little lidocaine here.
Okay.
We're going to squirt it in. I'll take the needle off. We're just going to squirt this in here. See if we can't give you a little bit of pain relief, because we're going to have to pack this again, okay?
Okay.
He's being kind to you today.
I'm always kind. That's a little shout out right there to all of my internet friends who chided me for not offering a little local anesthesia for the repacking.
You weren't going to offer a local?
We usually don't have to. How's that? Is that sore in there?
A little bit.
I'm just feeling now to see,
Oh, yeah.
improvement there. That's really good. Okay, we'll give it another few seconds to start working. We have your special bottle here. Okay. So it's New Year's Eve, huh?
Mm-hmm.
Okay, we're going to start working on putting some packing in here. Are you ready?
I guess.
Take a deep breath. Okay, good. And again. Blow it out. Really good. Again.
Yeah.
Take a little break. Deep breath. Good. Blow it out. And again. Big stick, big push there. Good. Again. So how you doing? Is it hurting a lot? Or just a little bit? Just a little bit?
Yeah.
Deep breath. Good. Okay. So you had some questions earlier about getting the sac out, didn't you?
Yes.
Okay, and so we talked about that. And sometimes we can and sometimes we can't. It all depends on lots of things like the age of the lesion and things like that. Now I'm going to pull the packing out. Are you ready?
Mm-hmm.
Here we go. Oh, look at that. That's a great looking wound. Look in there. Look how clean that is. That just looks so pretty. Okay. I'm shocked. But you're okay.
Yes.
You didn't, you weren't knocked unconscious or something.
No.
Wow. Okay. Did you have any fevers or chills?
No.
Good. You still taking your medicine?
Yes.
Okay. Let's take this packing out. You ready?
Take a deep breath.
Not bad at all. Looks like it's healing. We're going to squirt some lidocaine in here for you, okay?
Okay.
Ready?
Yes.
There we go. Give it a moment to work. Well, I didn't have anything anywhere nearly that exciting over the weekend. I didn't wreck any vehicles. Nothing like that. I mean, that does sound like fun, though. I'm just kidding, of course. Is that hurting at all?
A little tender, but...
This is looking really good. Yeah, I think we are going to need to pack this again, okay?
Okay.
Just this will be the last time, though, I promise.
That's what he said Friday.
No, I didn't. I said maybe. I didn't say definitely. All right, I just said maybe. Well, so you didn't sit around and watch football or...
Yesterday I laid on the couch only because it was too difficult to sit up.
Was your back hurting?
My neck. I think I strained the muscles in my neck.
Ow.
It's better today than it was yesterday, though.
Let's put some packing in here, okay?
Okay.
Did you go to the emergency room after the accident?
No.
Okay. I can give you a muscle relaxer to take. I can't have you suffering when you're under my care. Hurting?
No.
Okay.
Are you ready for school next week?
No.
Me either.
Is it next? Well, that's right.
I start next week.
Couple of-
Well, I start Tuesday.
Nursing student. I don't have any school next week.
I'm just gonna have to deal with my attitude.
But I already do that, so
True.
it's really not a big deal, is it?
Yeah, really.
Look at that. Looks so cute, doesn't it? That little dressing, little packing right there. It really does. Get a good close-up of that. There we go. So we'll be able to get that packing out with no problem. This time we're going to go 2 days, okay?
Okay.
So you come back on Wednesday, we'll remove that, and we will be done with the packing at that time.
Okay.
Okay? So this will be our last video. Do you want to say goodbye to everybody?
Bye, everyone.
And you did great, right?
I hope so.
Okay, bye.
Hey there, Dr. Gilmore fans. We have an update about Cocoa Skin Plus. It's the newest supplement from the marvelous mind of Dr. John Gilmore. The proprietary mix of high-potency biotin, extra virgin coconut oil, and vegetable extracts is great for thicker hair, stronger, healthier nails, and softer skin. So if you notice your hair lacks luster, your nails aren't what they used to be, or your skin is dry and chapped, it's time to check out Cocoa Skin Plus. I've personally found that it's way easier to prevent chapped lips than it is to treat them. And I used to take a coconut oil supplement for it, so switching over to Cocoa Plus was an upgrade for me. It was for Kelly too. Let's hear from her.
I used to take regular biotin for thicker hair, so switching over to Cocoa Skin Plus was a no-brainer.
Nice. We'll put an Amazon link below, so get your 90-day supply today. Hey folks, you spoke and we listened. Here's what you had to say about Meta 7.
I love it so much. It gives me so much energy during the day.
I've noticed a change in my hair, my nails, my blood pressure.
There's no doubt that it's a benefit to me. It gives me more stamina.
And it could actually help you lose weight.
Now, I haven't taken a nap in 6 months.
That's right, Meta 7. More and more people are sending in their testimonials. Weight loss, more energy, and generally feeling more alert during the day. Let's hear more.
I just reordered a 90-day supply. I have more energy, am in a better mood.
It's natural, it's amazing. I feel motivated to get out and do things that I didn't before.
I'm not tired during the day. I've worked 12-hour shifts.
Just go all day. It makes me feel great. I love it. And take it. It's wonderful stuff.
If you haven't tried Meta 7 yet, it's time to order yours from Amazon. Time to boost your metabolism and kick your energy level into high gear. There's an Amazon link in the description.